had another article here. This is some good news for the coronavirus, and then we're going to talk about vaccines here in a second. It says Dr. Fauci, this is the other thing too, when you read these articles, like I get into the news, there's so much conflicting, contradicting information. It's hard to sift through it and know what the hell's going on. So I haven't even read this article yet, but I want to read it because this was a good news article that I seen the other day that I just didn't get to. And then boom, I got bombarded yesterday and today with all this crazy ass super virus shit. But just the other day, an article had dropped and it said COVID-19 deaths fall to the lowest since October as the U.S. records 80,000 new cases. Says Dr. Anthony Fauci, the nation's top infectious disease expert, said he is confident that the mass vaccinations effort in the U.S. will prevent a fourth wave explosion of the coronavirus. As long as we keep vaccinating people efficiently and effectively, I don't think it's going to happen, Fauci told MSNBC Morning Joe on Tuesday. Now, this happened Tuesday where he said this shit, and now they talking about the super virus, the Antichrist, just happened today. That story came out today. All right, so it's the day by day, you can tell that these fuckers have no idea what they're talking about. In one breath, they try to play it down and say, oh, everything's gonna be okay, and then another article or some new news comes out where everything that they said is a contradictory of what's the real reality of what's going on. It says vaccinations could be set to speed up even further on Tuesday. President Biden has announced that state deadlines for universal vaccine eligibility would be moved up 2 weeks from May 1st to April 10th. So now they're trying to get everybody vaccinated in the next 3 days. Everybody who want to get vaccinated, they're moving the eligibility up. So by what is the day? Wednesday, you looking at Saturday. By Saturday, everybody should be able to get the vaccine who wants it. It says the country is on track to meet Biden's new goal of 200 million shots in the arms by the 100th day that he is in office. Fauci, the director of National Institute of Allergy and Infectious Disease, added that it will remain to be seen if states' relaxing measures leads to just an uptick in cases and if it will explode into a real surge. But he reiterated that I think that the vaccine is going to prevent that from happening. It says the deaths in America remain low, with 607 COVID-related fatalities reported on Monday and a 7-day rolling average of about 738, the lowest figures recorded since October 28, according to the Daily Mail. And this is from analysis data from Johns Hopkins University. So the deaths are down, but the cases are going up. And then now that the cases are going up and now that we have the new super variant that is 63% more deadly, there's a good damn chance that the deaths are going to start back going up because the deaths are always 2-3 weeks behind the cases, right? Because of course people don't die as soon as they get it. So when you see an uptick in the cases, usually you can say the deaths are going to follow. There's going to be an uptick in deaths. So as of right now, before this super variant hit, things seem to be settling down, but it's going to be interesting to see what's going to happen here in the next 2-3 weeks. Because again, as you see an uptick in cases, remember now, people get sick, you ain't gonna die as soon as you get sick. So it's about that 2-3 week lag as when somebody gets sick and then you'll see the actual deaths start to come in. So I'm gonna keep track of this shit for y'all as far as the coronavirus and try to keep y'all up to date on exactly what's going on. And as of right now, I know that New York is being hit hard. So New York Beach, you need to be careful, right? It says nearly half the new COVID cases in the US are in just 5 states, and New York is one of them. And I would probably say this is the new variant, the UK variant. It says New York, Michigan, of course, Florida, where they dropped the mask mandate and had the spring break, Pennsylvania, and New Jersey. Altogether have reported about 44% of the nation's new COVID-19 infections, or nearly 197,500 new cases. So that was for a week, right? And this is all coming from data coming from Johns Hopkins. So it's pretty sound data, man. Johns Hopkins University is where we usually track shit like this. So I would probably say that they're probably right. When it comes to vaccines, now let's talk about the vaccines. They saying that you might not even want to, I did a story the other day where I was talking about they talking about laminating your cards because you might need it for a travel pass, right? You might need it as a vaccine passport, so you want to keep your card safe. But now they saying don't laminate the cards. And it says the reason that you don't want to laminate your cards is because you could have to receive an extra shot. So if you already got if anybody's in the chat, anybody comes across this video in the next few days, if you already got your vaccine and you've got your double doses or you got the Johnson & Johnson 1 dose and you feel that you're protected, don't go laminating your cards and think you're out of the woods because it says you're going to have to add a good chance that booster shot or extra shots of this vaccine. Or you might need to be getting this vaccine all the goddamn time, right? Every 6 months, every 12 months, you might need to go get this shit put in your body. So this can be for those who are super vacciners, believe and trust every goddamn thing the government say and try to look down upon those who try to use caution and are very suspicious, especially of the United States government, who has been known to do all type of just horrific shit, especially the people who look like me. For those people who want to judge, do you, boo-boo. But just know, don't get too out the woods yet. Don't be too happy with your 2 shots, because now it looks like you're going to have to get another one. And another one. So I don't know, man. The vaccine, the virus, they both seem to be... It's crazy to me how a lot of people are more scared of the damn vaccine than the virus. That's something that's a curveball that I did not see coming. Right? It's just crazy to me, because I mean, that is kind of crazy, man. That the people have so little trust in the government in our country that people are more afraid of the vaccine than the goddamn virus itself. The virus done killed over 500,000 people, and we don't trust the government so much that we're willing to take our goddamn chances with the virus. Now, that's a problem in society. That's a problem for our country, and that just says a lot to what this country has become, right? People are literally saying, I'd rather take my goddamn chances with corona than take my chances with the government. The business say evolution doesn't happen this fast. We're being lied to. Yeah, I ain't gonna say evolution don't happen this fast when you're dealing with viruses, because viruses can mutate pretty damn quick. Again, like I say, the reason you have to get a flu shot every year is because the flu virus mutates. One of the reasons it mutates, again, but it would seem that the more vaccines you come, the more you try to kill it, the more you try to stop it, the more it's going to mutate, the faster it's going to push it to mutate. So evolution, I would agree, would not normally work this fast, B9. But when you have man pushing it along, this is what happens. So anytime you put man into the mix of anything, shit usually goes sideways. So evolution usually wouldn't work this fast, but of course you're leaving out a very important proponent that is helping this push and expediency of the evolution, and this man mucking around with shit. Right, man fucking around with different experimental shit is going to cause shit to ramp up. Again, the virus is not going to want to be expelled. So the more you push to try to goddamn destroy it, the more it's going to push to survive. And you really can have a situation where you have man propelling the expediency of the evolution of shit. That's just a theory, but I'm just saying, it just seems to be logical, right? So anytime you get man involved in any goddamn thing, there's going to be, it's not going to be smooth sailing. That's why I was just very skeptical when they try to make it like this was going to be the save all, end all, be all. My antennas went straight up. As soon as people started with this, oh, the vaccine's gonna set us free and save everything. As soon as I hear shit like that, I'm already on high alert. Like, okay, get ready for the bullshit. They were upplaying this shit way too much for me, right? They were overselling it way too. Anytime the federal government is overselling something, it's gonna make me hesitant, right? If you're gonna try to go out of your way, just think about when you're dealing with people, anybody, right? You're gonna go above and beyond and out of your way to try to make me believe something or try to make me think something's good. The more you do that, is almost artificial and cartoonish, the more it's gonna make me suspicious. Like, why the hell is you trying to push this so hard? And then it's gonna make me want to look into it. That's even if I meet you, if I meet a regular person. And the federal government, to me, is just trying to oversell this shit way too much. Especially to the point to where the shit is not even FDA approved, let alone trying to coerce people to take them. And if you want to take it, that's fine. I'm not knocking people who take it. I'm not saying if you should or you shouldn't. I'm not going to judge you if you take it. And I'm also not going to judge you if you decide not to take it right now. But my point is, it's just very strange to me, but that the nobody can argue this fact, and nobody else brings it up. Nobody in the news media brings it up. Nobody on these news YouTube shows bring it up. Right? It's just strange to me that the FDA will not approve the vaccines. Why won't the FDA approve the vaccines? If the vaccines are so safe and so effective, and you really want people to start to have trust in them, why don't they have the FDA approval stamp? Not the Moderna, not the Johnson & Johnson, nor the Pfizer. Not one vaccine has been approved by the FDA, the Food and Drug Administration. The only thing we really got to go by to make sure shit is safe for the population. And until that happens, I'm going to be in the boat of I'm definitely not taking it. And then when they do approve it, I'll think about it. about it, because again, there's no guarantees with the FDA, the CDC, or any other A's, the DA, none of the A's. There's no guarantee. So I don't even know why they keep pushing this and then having people saying, I got another story here that's going to lead right into what I'm talking about. So I just told you that the vaccine is not FDA approved. That's one. Okay, here we go. This is another report. Here, let me bring it up, man. I'd be liking y'all to kind of read along with me and see that I'm not jiving you or bullshitting, right? So I like to kind of, when I can, show you that I'm not, this ain't no conspiracy theory. This ain't me just making no shit up. I'm not going to be one of those type of, this ain't no Facebook or no Twitter or no some shit I seen on social media. These are articles that I'm reading and not from no conspiracy type of websites. So here, let's see what this says. At least 7 U.S. colleges have said that students must be fully vaccinated against COVID-19 to come back to their campuses this fall, with Brown University and Northeastern University the latest to implement such rules. Brown, Northeastern, Cornell University, Rutgers University, Fort Lewis College, Nova Southeastern University, and St. Edward's University each announced that COVID-19 vaccination requirements for returning for students in recent weeks. Students with specific underlying medical conditions and religious beliefs can apply to be exempt from the rule, which the institutions say is crucial to be able to welcome people back to in-person learning at full pre-pandemic capacity. The move comes as a third of the U.S. population is now at least partly inoculated against the virus, and Joe Biden is set to bring forward a roadmap for all American adults to be eligible to get the vaccine. So anyway, like I'm saying, here we go. How the hell do Brown University or any other university or any other business or anybody think that they can make someone take a substance that has not been approved by the FDA? I don't even know if that's legal. I wish I might go sign up for school so I could sue the shit out these people, right? Because I could know there's gonna be some lawsuits coming around, easy lawsuits. I wish my daughter was old enough. She's the closest to it. Was old enough to get. I would have get the Brown. We gonna sue these some bitches. You can't force nobody to take. I would have to look up the law on that, but I'm gonna just jump out on a limb and say, if something is not FDA approved, how the hell can you force somebody to take something that's not FDA approved? That don't even go together. You cannot make me take something that's not FDA approved. The federal government has not approved the vaccines for human use. I'm gonna repeat, they have not approved the vaccines for human use. The only reason we have these vaccines right now and everybody is shoving them into their goddamn arms is simply because it was all approved under Emergency Authorization Act. Trump signed the Emergency Authorization Act, which had the vaccine rollout, which gave companies the opportunity to go ahead and roll out the vaccine and start testing the general population. And as of right now, it's still under that Trump order, that executive order he put past. It has nothing to do with being FDA approved, because the reason they can't FDA approve it because there's not enough data and research on these vaccines yet. And until there is, you will not see a stamp of the FDA. They didn't go through the regular process that we go through to have shit approved by the FDA and do the vigorous testing and right now we're all guinea pigs and the tests are happening as we speak in real time, right? So this is the test. So of course the FDA is not going to prove it. That way you can't be, nobody could be like Moderna, Pfizer, Johnson & Johnson can't be held legally liable. So if something does happen with these vaccines or something crazy happens to your children or you ain't gonna have no recourse, meaning you ain't gonna be able to go sue or do anything, because they're gonna say, well, it was voluntary, you took it, nobody made you, right? But now you're gonna have a place where you can have lawsuits, because now you have entities making people take it. So if something happens, this is gonna open people up for all type of legal culpability. You understand what I'm saying? So the reason the FDA did not approve any of the vaccines, they don't have the FDA stamp of approval, because without them telling you, right, they're making you feel and seem like you have to take it, but without them telling you is that this is all voluntary. They're just putting a lot of pressure and adding this huge ass pressure campaign to make you feel like, oh, if you don't take it, you some type of, you feel out of place, right? They're trying to bully you, and basically it's a bully campaign. They're gonna bully you into doing what the hell they want you to do. But there's no stipulation or no law. I just talked to somebody that's a part of the politics as usual the other day and said they about to finish school and they're going into the workforce and they're scared that they're gonna have to be forced to take the vaccine. They're going into be an essential worker or the medical field. But I had explained to her that guess who's not taking the vaccine? A whole lot of doctors and nurses are not getting getting vaccinated. People who administer the vaccine, people who are trained medical professionals are not taking the vaccine. Now, ask yourself, why is there so many doctors and nurses? I just did a story on it. This is a fact, right? They're trying to figure out a way to change the messaging. So I guess they're trying this bully campaign, and they're seeing that it's not working, because anybody who's gonna feel like you're trying to bully them is gonna make me push back harder. You're not gonna force me to do some shit that I'm not sure about or I don't want to do. That's number one. Number two, the more that you try to push me to do some shit that I'm not sure about or don't want to do, the more I'm not gonna goddamn do it. So I think that they're starting to realize that this, but the weak people, the sheep, those who can't think for themselves, they're gonna be able to fall in line. They're gonna feel so, oh well, Joe Biden, the government said I gotta get the vaccine. I guess I gotta go get the vaccine. Everybody's gonna look at me strange. Everybody's gonna judge me. I don't give a damn. I don't give a damn about none of that. I give a damn about my kids, their future, and I got to make conscious decisions for me and my family. I could care less of what the hell you think about it. So and I'm not going to let nobody pressure me or bully me, but that's what it seems like the government's trying to do, because without letting everybody know that these vaccines are not FDA approved and you don't have to take them. Now, I don't know how these colleges think that they're going to force children to take them, but if you're going to force the college students to take the vaccine, and if anything happens, then that would open up the colleges for litigation, and I would think that would open up the manufacturers for litigation, because now you're being forced to, you're being coerced into taking it. The doctors are taking the placebo. Well, I just did a story that there's a lot of doctors, medical professionals around the country that won't get vaccinated. There's a lot of cops that refuse to take the vaccine, a lot of COs. There's hundreds of thousands of them that won't take it. Why do you think they're trying to give it to people like us? It didn't go the way they planned it. They planned that they was going to roll the vaccine out, and the first people that was going to be first in line was going to be the healthcare workers and shit like that. But as they rolled it out, the doctors was like, ain't no motherfucking data on this, right? Doctors, this is what they train for. They look at data. They're scientists. Ain't no data on this, on none of these vaccines. There's no data on it. Like, the data is actually happening and we're watching it in real time. When my people that I know get vaccinated, that is data. I'm looking to see what the hell happened to them. Just like Moderna, Johnson & Johnson, and Pfizer looking. They looking too. Like, let's see. This is the trial. I don't know if y'all know this, people. I keep trying to repeat this to everybody who comes to politics as usual. We are in a trial phase of the vaccine. You know, usually you have the 5 trial phases. Then when the trials are over, the vaccine is shown to be effective and safe, and then they put it out to the public. They skip the trial phase. This is the trial phase. We are in the middle of a trial phase for the vaccines. Now, again, I'm not telling people to take the vaccines. I appreciate people who do, even when the trials and shit, like people who, you know, sign up to get ahead and be guinea pigs. We need those in society, because I don't have the heart to do it, and I don't have the heart to send my kids. So people who take their kids to be guinea pigs, and they go take them little bit of dollars that they give them to go get the research done on them, their children, we need those people. We need sacrificial lambs. What can I say? This is a fact, because I'm not going to do it. I'm not going to let my damn kid, I'm not signing my kids up to go be tested on. Well, if you want to sign your kids and you up to do that shit, then I'm not going to oppose you. And I want to know if it's safe so I can give it to my kids. And then if it's not, too bad for you and your kid. If that's the decision you going to make. I've never been part of any trial study of anything that goes inside my body.